on the News Channel 5 network. This is Open Line.
Hello, everyone. Welcome to Open Line. Glad you're with us tonight. We're talking about a very important topic. It's affecting so many people in Tennessee and really across the entire country. We're talking about the opioid crisis. We've done a lot of stories about where we are, but what we're going to talk about tonight is where we stand and how the courts are helping to fight against what continues to be a major crisis in our state. We're happy to have with us Debbie Tate. She is the director of the courts for the state of Tennessee. Thank you for being with us.
Thank you, Ben.
And you've brought stuff, and we appreciate that. And we also have Dr. Stephen Patrick, Associate Professor of Pediatrics and Health Policy at Vanderbilt. Thank you for being with us. Of course. You may have some other titles we'll get to as well. All right, we've done lots of stories about this crisis, but why is this different than other crises? Kind of put things in perspective for us.
Sure. You know, it's kind of hard to imagine as the director of the courts or as a lawyer or a judge being involved in something that is such a healthcare crisis today. But it is inconceivable to me that this epidemic is now at the point where 4 Tennesseans die every single day and continue to die. And so I think one of the things that people don't really realize is that the courts are the place where all of this really intersects. And that we are, the whole law enforcement criminal justice system, we are the #1 referral source for the opioid crisis, for people to get help and stay in recovery out of anything other than self-referrals. And so we've become extremely engaged in the issue at all levels of the court system.
Well, it's good. We've certainly covered it on this show, but it's good that the courts are another group that is kind of getting involved and focusing on how bad it is. And Dr. Patrick, put in perspective, we've been talking about it for a long time. Some might think it's getting better, but what do you see?
What we've seen is a leveling off of overdose deaths in some states, but not in Tennessee. Tennessee, it still went up last year. So this continues to be a crisis. We still have, like we just discussed, 4 Tennesseans a day that die from overdose deaths. We still have about 1,000 babies born every year that have opioid withdrawal. We've made a lot of progress in the state of Tennessee and have really led the way in many public policy approaches and public health approaches, but there really is a lot more work to go. And one of the things I worry about is that we're becoming numb to the crisis a bit.
Yeah.
And this really does take a fundamental shift. It takes unique partnerships, like you see here, to really get at the heart of some of these issues.
I think you might be right about becoming numb, because we have talked about it for a long time.
Right.
But there's some statistics that just kind of hit you in the head. National life expectancy has dropped for 3 years in a row.
Right.
And I'm sure we're seeing that in Tennessee, right? Why is that happening?
The opioid crisis. I mean, plain and simple, we're seeing the opioid crisis lead to a decrease in life expectancy like we haven't seen it before. You know, we see things, and even from some of our research, on trying to understand what's at the baseline of some of these deaths and some of this, even babies having opioid withdrawal. The term deaths of despair has come up. When we look in parts of Appalachia in particular, it's not just about the substance, it's about what's going around. It's lack of jobs, lack of economic opportunity, the change of social fabric. That is really at the baseline for many of the things that we see.
And some of the higher annual rate than Vietnam and the AIDS crisis.
Yes.
So, I mean, these numbers are astounding.
They are.
And so the courts have been involved, right?
Right,
But
right.
are they stepping up what they're doing now?
Yes, absolutely. And it's interesting that you gave that example, because it's not just about drug courts or people who are in criminal court because they've been arrested for selling drugs, but we are seeing this in every single step of the court system. So in juvenile courts, we're seeing more and more children be removed from their parents, or sometimes even their grandparents, who have custody of them, and being placed into state custody with DCS or with foster care parents. We're seeing all the civil issues: bankruptcy, loss of job, losing where you live, eviction, all of those civil justice issues that emanate from an opioid crisis. And so we are, I'm very proud to say, training all of our judges. So we've trained over 1,000 judges in not only identification of whether someone may have an addiction, but also what they can put into their orders. You know, it's both a carrot and a stick about judges are the ones who have the keys to your liberty. And so we are also trying to be advocates for what we also need. Women are staying longer and serving longer prison sentences or serving in jail because there's no place for them to go. So we're trying to be advocates in terms of both the governor's budget and the legislature's appropriation so that there will be more facilities for women.
That's interesting. I've certainly covered in some smaller counties where they don't have big jails. More women are being arrested now,
right,
and they don't know what to do with them.
Right.
But you're talking about it from the perspective of treatment centers, right?
Yes.
There's not enough treatment.
Right.
And we've heard that over and over. And are judges pushing for that? I mean, do you feel like they're being heard?
Absolutely. And so one of my favorite judges is Judge Dwayne Sloan from Appalachia, one of the hardest place hit area. And so he actually pulled his community together. One of the things that we're trying to get judges to understand is that often they are the leader in their community. If they will convene a community discussion forum summit to talk about these issues. So Judge Sloan was actually able to have a cabin donated that is now a recovery cabin for women who he has seen in his court, pregnant women who have been using but are seeking to get into recovery and get treatment. And so now in one little county in Upper East Tennessee, they're able to go, and every baby has been born, not necessarily totally unaffected, but been born a healthy baby and has not had to go to a NICU like where Dr. Patrick is every day.
And that's where you work every day, and that's what you're seeing a lot of, right? And the impact on foster care, and I guess talk about that a little bit.
So the work that we do is taking care of babies that have opioid withdrawal, and we have fundamentally shifted the way that we care for that. Over the last year at Vanderbilt, we've seen around 250 opioid-exposed infants. And it used to be we separated mom and baby at birth, and the baby went off to an ICU.
That's very expensive.
Right. Traumatic for mom, and you're taking a baby away to a loud, chaotic environment where there's ventilators and things like that. Instead, we keep mom and baby together outside the ICU, and we support the family with resources. It's fundamentally shifted what we see. We see babies have less severe withdrawal. Most of our babies go home with mom. We're seeing one of the victories we've seen in Tennessee over the last few years is more moms in treatment than not of babies that have opioid withdrawal. But it's complex. You know, people oftentimes ask, what does drug withdrawal look like in a baby? And what I typically describe it is a colicky baby times 5. Babies that have drug withdrawal are fussy, they're irritable, they have increased muscle tone, and they shake a bit. They have difficulty sleeping. That's kind of what they look like. They require medical treatment, but they don't always require intensive care, and that's what we found.
Is a baby that's born with that immediately, it seems like they would be taken from the parent. Couldn't the parent be charged? And I guess, is that what we used to do, or is it seems like the baby would immediately be put in foster care?
Yeah, it's a great point. One of the things is to really step back. And when I was first faced with this, so it wasn't that long ago that we never saw babies having opioid withdrawal. Now we do. And there's a long story that leads up to that baby having drug withdrawal. We know that about 70% of women with opioid use disorder have a history of physical or sexual abuse. Oftentimes, opioid use and misuse happens well before pregnancy. So for many of these women, they may have become addicted to an opioid in high school at a party, 10 years ago even, and they've been taking a medication to treat that called Subutex, and they're in treatment for that. So they're in treatment for that decreases their risk of death, and it increases the likelihood that baby will be born at term, but that baby may have drug withdrawal. So in many cases, those moms of babies who have drug withdrawal are doing absolutely everything right. And I think that is something we don't always understand.
And is there a stigma with treatment? What about that, and what can judges do to help overcome that?
Absolutely, and I mean, part of that was also convincing the judges that medically assisted treatment is the way to go, because many judges for a long time have felt like it's just abstinence and abstinence only. Aren't we just trading one drug for another? And the doctor can certainly talk about that. But in this case, that is really not what you're doing at all. You're trying to actually prevent the receptors that have this high intensity, that the opioids, change the organic nature of your brain, which we want to stop. And for people who are wanting to seek treatment, we want to encourage that. I was just at a Safe Baby Court graduation, a couple of weeks ago, and it's just absolutely amazing to see people who are committed to this recovery, but they needed help, they needed assistance, and they needed to have a judge or someone who was going to keep up with them week after week after week. A lot of these people grew up in homes where they never had anybody who cared about them. They now have children, and so that's what we are all trying to provide for them, that consistency to encourage them to stay in treatment after they seek treatment.
And doctor, how successful is treatment?
It can be successful. So one of the things I like to talk about is, why are we talking about using a medication? So if someone's using heroin, let's talk about a pregnant woman who's using heroin. Both her and the baby go through these rapid cycles of intoxication and withdrawal, and intoxication and withdrawal. That increases her risk of death, and it's very stressful on the fetus. That baby is more likely to have a lower birth weight or be born preterm. So medications like Subutex, what they do, or buprenorphine is another name for that drug, it levels that off. And it helps mom get into recovery. It decreases her risk of death by about 50%, and it increases the likelihood that that baby will be born at term, but perhaps with some drug withdrawal. So it does work, and it does work particularly compared to the alternative. One of the things we have to understand is that this isn't perfect. I always like to talk about this in the context of diabetes. Diabetes is a chronic relapsing condition. Addiction, we know more and more about their brain chemistry, is also a chronic relapsing condition. I see a lot of babies that have diabetes complications from uncontrolled diabetes. We aren't arresting those women. And so we have to think about this in a different context. People do have relapses. It does happen. It is in the context of the broader recovery. Diabetics sometimes have relapses too. And we talk about stigma. That stigma about substance use certainly exists, and it certainly prevents people from seeking out treatment.
And you said, well, go ahead.
Well, I was just going to say, and it's not just about the medication, it's also about the therapy and the social supports and the community supports that go along with the medication.
And you said you were worried that we were getting numb to the crisis. And I think that is a fascinating statement. We know there are tons of people out there hurting. Every time we do this show, we get
right.
calls from people who know someone or who themselves are hurting.
Absolutely.
And we've talked about this for so long. I just want to get from each of you, are you confident we can turn this around? Like, what is the hope you have that we're making a difference and we will turn this around? How long will it take, I guess, would be the question.
Well, I guess my response to how long will it take is it took us a decade to get here. And so I think we have to be careful about, I was so saddened the day that the CDC report came out that Dr. Patrick referenced, where, these other states have seen a reduction in overdoses. We've seen an increase. It was so depressing to me that day. Actually, I think I even reached out to you because I just thought, here we are doing all this, we're training all these judges, you're working with so many families and moms, and we feel like we're seeing change happen, and then the numbers come out and they're not. But I think we also have to realize how long it took and how hard Tennessee was impacted. But you're exactly right, Ben. I mean, 1 in 4 families is going to be impacted by either addiction or a mental health disorder, behavioral health crisis. And so there are 4 of us in the studio. Mm-hmm. I mean, we all know someone. I know someone. Dr. Patrick was kind enough to come to our church, and after we spoke at our church, which I would really encourage churches to have, forums for their members. But after we talked, so many of my church members that I had no idea who either are suffering or have a very close family member who are suffering. So we also want to say, yes, there is hope. And one of the things that we want to talk about are some of the resources. But I'll let Dr. Patrick talk.
And then, answer that question, then we'll take a break. And we'll get to the resources.
I'm optimistic, absolutely. And the things that make me optimistic are people like Director Tate. The amount of passion and the way this is bringing people together, I think, is inspiring. And I think we do have to look at this. And so compare this to more people died from an opioid overdose last year than died at the height of the AIDS epidemic or at the height of the car crash epidemic. we didn't fix those by accident. We fixed those by taking public health structured responses. We did that with HIV with Ryan White. So it is going to take more coordination and resources. And we do need more resources from both the federal government, the state government, and it needs to be long lasting. But there are so many engaged partners, and I see things changing for maternal and child health that are positive, that I think that will endure well beyond the opioid crisis.
Great. Well, that sets the table for what we're going to talk about. If you want to call in, there is the number. Want to hear your story, your thoughts, whatever. There's the number, 615-737-PLUS, 615-737-7587. Michael, others on the line, hold on. We'll get to your call. Take a break. Be back right after this.